If you are in medical billing, you know how annoying claim denials can be. If you aren't in medical billing, you're probably wondering why they are so annoying. To put it briefly, it's because there are hundreds of denial codes that are not technically standardized across all insurance companies. Along with the fact that the complexity of these denials require well-trained staff equipped with educational programs, which many practices might be lacking either one or the other, or both. But have no fear, there are some denial codes that are more common than others, and by familiarizing yourself with them, you could save yourself some hassle in the future. Let's look at denial code PR204. Hi everyone, I'm Maria from eTactics, and today I'm going to talk to you about denial code PR204. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so that when we post new, helpful content, you get notified. If you received denial code PR204, here are a few things to keep in mind. The PR in this equation stands for patient responsibility. This means that the amount due on the bill is the responsibility of the patient. According to the insurance company, the patient needs to pay the bill due to the fact that their plan doesn't cover the specific service or product provided. This is where the next part of the code comes into play. The exact definition for the 204 portion is that the services, medicines, and/or equipment is not covered under the patient's current benefit plan. So what should you do when you run into this denial code? Definitely don't ignore it. Here's a real-world example explaining why. A hospital with about 900 beds received 156 of these denial codes in Q1 of 2023. These denials ended up totaling about $3 million. I know I personally wouldn't want to miss out on $3 million, and that was just in the first quarter of their year. You can imagine the client didn't want to see that revenue go either, nor did they want to see that number climb in the second quarter. The problem was, how would they recover that money from so many patients? Well, definitely not by ignoring the problem. It's true that in most cases, all of the inclusions and exclusions are in the policy papers, and that appealing this code can be tricky. But there's always a chance of finding a discrepancy, which hopefully can help you make an appeal to the payer. For example, you may be able to find a different and more appropriate procedure code that can cover the payer under their plan. Maybe you can appeal to the insurance by stating that the services or product falls under a specific kind of coverage. Or in a worst case scenario, you can just take the insurance company at their word and bill the patient for the total. Just be mindful of any laws or regulations that might restrict when to bill the patient. With nationwide staff shortages, landmark regulation, a shifting economy, and lack of standardization among payers, there is little room for error in collecting revenue. Figuring out how to reduce errors during your claims process is the best place to start. Utilizing clearinghouses can help you expedite your claims process by executing claim scrubbing and instantly flagging errors before sending to the payer. If you'd like to learn more about denial code PR204, reach out to eTactics, and you already made it this far into the video, so you might as well like it, share it, and comment below.